Most people would have let that define their ceiling.
Yes.
Why didn't you?
I have always done my best, been just so active and just never played the victim.
At what point in your career do you feel like you would finally outrun those health struggles?
Maybe 4 years into practice when I hit that wall.
Every solution in the medical system was pharmaceutical surgery.
I just knew there had to be a better way. All we do is focus on breathing and sleep, so addressing the root cause of what's going on. So no CPAP, no surgery, no drugs, great sleep.
Hello, welcome to the Blue Room. Today we're here with Dr. Tara Griffin. She is the co-founder of Sleep Solution Centers. Say that 3 times real fast. Sleep Solution Centers. Dr. Tara, your mom said she never thought you'd be the doctor in the family. Who were you growing up? What did that little girl actually go through physically?
Oh, what a beautiful question.
We're going to dive right in.
I know. Yes, out of my 2 sisters and I was the middle child, and my mother did say that. We never thought Tara would be the doctor in the family. So as a child, I was very sick. I could not breathe. From the time that I was born, I was just chronically had a lot of inflammation, issues with breathing, asthma, allergies, and one year, like around 2nd grade, I was hospitalized almost the entire year and held back a grade in school.
Really?
So it was just a chronic issue that it was almost like I was born with it, but my body was very sensitive and allergic. And what I later discovered was that my jaw and airway were underdeveloped, leading to a lot of those breathing problems and allergy problems and health problems that I had. So I wasn't as academically, on top of everything as much as my sisters were. I was more athletic, though. I was performing and doing everything that way. So I didn't let that struggle to breathe hold me back. But at the same time, academics wasn't the area that I was, really excited about. I just wanted to enjoy and have fun. That's what I wanted to do as a child, right? So that's what she meant by that, because I just didn't have kind of the same drive in that way, versus how my sisters were. And that was really linked to the fact that I wasn't breathing and sleeping well as a child.
Of course. You had tonsils, adenoids out before age 3, ear tubes 3 times by 7, held back in 2nd grade. Most people would have let that define their ceiling.
Yes.
Why didn't you?
I have always done my best, been just so active and just never played the victim of those challenges. Mm-hmm. And it wasn't until much later that I realized all of that was honestly a blessing to help get me where I am today. Because eventually, when my body did start to break down and collapse, and I realized that's actually what led me into this field.
It was meant to be.
Yes.
Wow. So you became a dentist and opened your own practice in Northwest Florida. At what point in your career do you feel like you would finally outrun those health struggles? When you became a doctor?
No, actually, yes, I graduated. I moved to North Florida, Panhandle area, and practiced up there for about 17 years. But I was only maybe 4 years into practice when I hit that wall. And what came down was the head and neck pain, the fatigue, the chronic allergies, rhinitis, sinusitis, colitis, every system, bronchitis, pneumonia,
too.
Every system was completely messed up. And it was crippling to me, especially the pain that I was experiencing, the jaw pain and headaches.
And why do you blame that all on being a dentist?
Well, I was thinking at the time, because we make excuses for how we're feeling, that, I'm tired, I own a business, and we're busy, and we're doing this all the time. I'm hunched over doing dentistry all day. Of course, my back's going to hurt, my neck's going to hurt, things like that. But I was very early in my career. I should not have been feeling that. I was, early 30 years old or so. And then upon my journey to help with the solution, because I realized if I'm going to continue to feel this way, I cannot continue to practice dentistry. This is debilitating. So I had to find a solution. And every path that I went down was either surgery to address my sinuses, surgery to correct my jaw, or medications to stay awake because I was so tired all the time, or medications to sleep. And I just knew there had to be a better way.
This is very similar to my opening serotonin centers. I kept, there's got to be a better way. This can't be my life. I remember thinking one day, this is my life. This can't be. I mean, I was being told this is normal. You're busy. You want to,
Yes.
you're a business. You're a mom. All these things, and that was what motivated me. It's just, I can't live this way. You can't do what you love.
No.
Every solution in the medical system was pharmaceutical surgery, but you kept on looking. You didn't accept that, and I totally respect that. I can definitely identify with that because that's the same thing that happened to me. So tell me about how the DNA device. Tell me about that.
Yeah, so I discovered on that journey, looking for a solution that was more root cause, non-surgical, seeing if there was another way of addressing these issues. I discovered a doctor, Dave Singh, who became a mentor of mine for a very long time, and he had invented a mouthpiece that you wear in your mouth in the early evening and while you sleep at night that actually stimulates development of the jaw and stabilizes the joints, the TMJ joints, which is where a lot of my problems were, and helps to remodel or grow your airway. And
really?
Yes. And so after discovering him and learning from him, I came back from the initial conference that I attended and was excited to be my own first patient and see if this really worked.
Wow.
Yeah.
So your sleep improved. Within weeks, pain resolved. Wow. So now you run a sleep study center.
Yes. So now all we do is focus on breathing and sleep for children and adults, addressing the root cause of what's going on. So no CPAP, no surgery, no drugs, great sleep.
So
and
I'm
no
very-
dentistry.
I'm very
we
intrigued
don't
with
do
this.
any dentistry either anymore. We just solely focus on sleep and airway problems.
How
for
did you
people.
make that transition?
Well, that path of my own, once I discovered that and treated myself and saw how well that reduced all those symptoms, my life turned around. It was almost overnight, it seemed like. My sleep improved drastically. My energy levels started increasing. Again, the pain dissipated very quickly. And then I was set. I was on this journey. So I went throughout a year and a half or so of just walking through this process and seeing what was going to continue to happen. And in the meantime, I started treating patients. And I realized that if I have this outcome, I think there are millions of other people that are looking for the same type of solution that want this outcome too. So
It is incredible how important sleep is. Sleep is one of the major things. I always tell this story about, my husband used to call it haunting the house. Because when I started going through perimenopause, I couldn't sleep. And I had a long nightgown that hit the floor. And so at night, it just looked like I was a specter haunting the house. And because I just couldn't sleep, and it incredibly affected my function the next day. So, how does poor sleep systematically affect the body?
Oh, there are a number of things. And the other thing, though, before we even get into the sleep aspect of it, because sleep is crucial, okay, when we think about the main pillars of our health, what we need basically for survival. So we need food, we need water, okay, but we can go days and even weeks, without food, especially. We can go weeks and months without food, and we can only go a few nights without sleep before our body will actually pass out on us and make us sleep, as well as breathing. So breathing is something that we actually only can go a few minutes without. So breathing is the first thing, and then how your breathing affects how you're sleeping. So that especially is how our Sleep Solution Center's practice comes together, because really our core focus is helping people breathe better, like day and night, breathe better all the time. And by breathing better, we're going to naturally be sleeping better. And then especially when we add complements like the services that you offer, now sleep is really that big foundational thing. But we couldn't call ourselves breathing solutions because no one realizes they have a breathing problem.
That is so true.
Yeah, they don't
I've never
realize
thought of it from that perspective.
I know, but that's actually the root cause is how you're breathing, and then that's affecting the sleep, causing a sleep breathing disorder, which is extremely common and much underdiagnosed for everyone. And that's the basis of really what we do
I'm
as
so
far as
happy
helping people.
You're sharing this, because that is exactly what you said. People don't think of it that way.
No,
As-
we
as
don't
a
realize
breathing.
that we're poor breathers.
And there are so many other things too: colitis, asthma, chronic bronchitis, gut issues, and they all improved when you started sleeping properly.
Yes, the
Help me,
breathing and the
how do
sleeping
you
help
connect those
to
dots?
help to balance the system. Our body is designed to heal itself. We just need the basic core things, and we need to regulate it better. So regulating the nervous system, but things like breath work. I mean, they're things that I do on a daily basis just to help stabilize the system and regulate it so that it keeps the inflammation down. And there's so many different avenues, you know, and then hormone replacement. I mean, that was a huge aspect as well too. So as things, you know, continued to progress forward. But initially at that time, I didn't have any other intervention other than solely a mouthpiece. Today, we have so many other avenues of treatment within our practice and the scope of our practice that now we can help even more quickly and more comprehensively by addressing all three parts of the airway instead of, you know, just the lower part of the airway. So it just became more comprehensive. And
What are the
it's-
3 parts of the airway?
yeah, so the 3 parts that we address, we take a head and neck CT scan, so almost a full view
Right
of
in
your
the-
head
right
and neck.
in the center.
In the center when you come in. Everyone at their initial evaluation gets a head and neck CT exam done. And that scan, and it's also a dental scan. It's the lowest radiation on the market, so it's extremely low, so there's not a big concern there, only a fraction of what a medical CT actually would have in it. And we take that large volume, though, and we actually show it to patients. So you normally do not go to a doctor that shows you images of, of your body or airway, or hardly ever, you know. And so we look at the upper part of the airway, which we consider the nose and the sinus area here. We look at that completely to see what's going on there, if there's any restriction or inflammation. We look at the middle part, which is actually like when you open and say, ah, it's the tissue that hangs down, the soft palate tissue right there. We look at that part of the airway and see if that's inflamed or restricted as far as on the imaging. And then we look at the lower, what we call the lower third of the airway, which is right down here behind your tongue and your lower jaw. So we have 3 segments that we look at, and we can determine from there what might be creating or causing part of the problem if you have poor breathing and poor sleep. And that's how we systematically are able to get such great outcomes, because we don't just look at part of it, we look at all of it and really address more of the underlying root cause. And no other practitioner really does that the same way that we do. So
That is
it's-
really interesting. I
it's-
never thought of it like
yeah,
that.
and people don't. So that's, you know, we have patients come from all over the world to get treated here in Orlando. I mean, that's part of why I relocated down here, is to be next to an airport where people could literally fly in.
Really?
Oh, they fly in for the day and fly right back out.
Get
after
outta
getting-
here.
Yes, no. Dubai is the furthest country that a patient has come from for
Really?
treatment. Yes. That's
incredibly
South
interesting.
America, Europe, I mean, all around, patients, and then around the country as well, too. Just flying in for treatment and flying back out. So,
Wow.
but that's how much of a difference in experience that they have and how much better they are, is they're willing to actually do that to invest in their health and address the root cause of what's going on.
I never
So,
thought about it like that. When
yeah.
you talk about the 3 different areas just now.
Oh
it
yeah,
never even
it's
occurred to me.
they all contribute so closely together. And of course, as you know, as we start to discuss like the implementation of what you're doing, we can't do this all on our own. We're handling these parts of the airway, and we're handling it more from a functional way of how we're addressing it, you know, without surgery and drugs and things like that. And so more natural osteopathic types of treatments, laser therapies, just, you know, things like that. But at the same time, we also need to address from your perspective of what you're doing as well, too, to really optimize internally everything else that may be contributing as far as hormones and stuff like that.
So that brings me to my next question about what hormones do to your mouth. And I don't think a lot of women even think about this. What actually happens to your gums and your oral health when your hormones start to decline? And is that something that you started noticing?
Yes, and I especially, because I'm focused on the airway, it definitely affects the gums and the teeth and everything inside the mouth as far as hormonal changes. But one of the things that it'll start affecting even before that will continue to drive the gum changes and issues there is the effects on the airway. Because again, that's first and foremost, that kind of trumps everything else. So as estrogen levels change, progesterone and testosterone, all 3 for women. As those start to fluctuate and change, then it affects our airway, where it starts creating more inflammation, more collapse in our airway, less stability, even the brain's, drive to breathe and the levels of carbon dioxide. All those things get regulated by those hormones, and people don't know that. So one of the largest groups of people that we treat are females. And females and children especially are the two most underdiagnosed in this whole area of medicine, and they often go years before they get any sort of treatment. So with females, people don't realize that by the time you reach perimenopause or menopause, you're 2 to 3 times more likely to develop sleep apnea. And you're going to have this onset of snoring out of nowhere that you've never had before.
Another aspect of hormone replacement I didn't even know about.
Yes, snoring is one of the first onsets for women. They come in all the time. They're what we call young, fit female syndrome. So they're young, they're small, they're fit. It's nothing that's really necessarily weight driven, and things like that. And they are like, why all of a sudden am I starting to snore at night? This is, embarrassing. I don't want to be doing this. And, it's normally more common for the female to be elbowing their husband and saying, hey,
wow,
versus,
estrogen loss.
But that's one of the main contributing factors is we have a quote, when estrogen walks out the door, snore no more. And that's where we use our laser therapy on the tissue and the throat. And it just helps stimulate collagen, shrink, tone, tighten it. And then in combination with any therapies as well too, like, estrogen replacements and stuff, it just, the body is happy and you're no longer snoring and you're breathing better. But that can develop further into sleep apnea. So snoring can be one of the first signs of an airway issue or breathing issue, and before the onset of everything else even comes on. So that's why it's important to test. That's another motto. We have a lot of little mottos that we use. Don't guess, just test. So from the time that you even start to snore or start to have symptoms of anything, unexpected weight gain or, just fatigue, all these different things. Women present also differently in regards to the chief complaints that women normally have are going to be insomnia, anxiety, depression, brain fog, migraines, jaw pain, all these different things, fatigue, especially fatigue, grinding their teeth, all those things. And then they go to someone and they say, oh, it's all in your head, or here, take this medication.
No.
Those are the two things. Those are the solutions that are typically told to a female that presents with those types of symptoms. And that is by far, again, what we have the most success helping with some of these natural types of therapies to be able to help give the body back what it needs. It's not hard to do. It's just not well known that it's available.
I am so thrilled that I met you. When you told me this, I just couldn't believe it because I didn't even think about that part of it. But it is so important.
Yeah, we don't realize
because my mom has been getting Botox in the jaw and the temple.
Yeah.
And what is your remedy?
So yes, when I remember back when I first started in this around 2010. That was some of the therapies that I started to do, because at that time I didn't have laser therapies like I have in the office today. So now we have non-invasive lasers that treat more of the root cause of what's going on, bringing blood flow back to the area, helping regenerate the tissues. And then in combination with some of the therapies like nasal release therapy, things that are helping to stabilize the tissues overall in the head and neck area here, balance like the cranial rhythms and movements in the tissues there, that can really help to address more of the root of what's going on, as well as any type of specialized oral device or mouthpiece that might stabilize the jaw as well too, if people are clenching or grinding. But if they're clenching and grinding and that's driving part of what's going on with pain or headaches or jaw issues, that is often a nasal restriction problem. So when we address the nose and get the nose opened up better and deflamed, then that tendency to start to clench and grind, especially at night, goes away.
I'm I'm sitting here thinking that the connection that it makes to when I started hormone replacement, I couldn't sleep. So if I were, because I felt like I couldn't quiet my mind, but if I were breathing properly, I could do some breath work and maybe
Yes.
calm myself.
Yes, the
That would've
breath
been-
the
that would've
breath
been
will
helpful.
calm your system
Yeah,
down
it never even occurred to
you're
me.
if you're doing it correctly and you're getting better oxygen exchange and being able to produce nitric oxide. Everything that happens inside the nose that does not happen inside the mouth when we breathe through our mouth, that doesn't happen, only through our nose. And
Oh, really? So we should all be breathing through our
We should be
nose?
nasal breathers. Yeah,
Oh,
research
okay.
has shown that nasal breathing is on average 20 to 25% more efficient than mouth breathing. And the more we're breathing better, deeper through our nose too. It's not shallow nasal breathing. It's slow, deep nasal breathing.
You're going-
So yeah,
I'm quietly.
and when
do
we're
what you
when we're
tell me.
speaking and talking a lot and throughout our day, depending on our occupations and doing that all day, we're mouth breathing all day long. So we will be exhausted by the end of the day because we've been running our mouth all day.
Right.
Yeah.
That makes so much sense. I never thought about it like
And
that.
then you just have to stop and breathe. So throughout the day, just periodically stopping and taking in just a few minutes of just some good deep breaths when you then take that pause. It's amazing what that does to your nervous system
Sure.
and your brain, especially just to calm things down.
Wow. That is incredible. I had no idea that it worked that way. Even what you're just saying to me about, of course, that makes sense. So I want to shift gears for a second and get a little personal with you because I know you started hormones yourself. So, of course, you know my story and everything that I went through. And it's very similar to what you're talking about when you say that you go for assistance and you're like, oh, well, we're not going to look at the root cause. We're just going to give you a prescription. And so we, of course, at Serotonin, we like to go deeper, and hormone replacement is such a critical part of all of the processes in your body. And now I've learned, thanks to you, that your oral health and your sleep health is very impacted
Your
by
airway
that.
health.
Yeah,
Your
your
airway health,
I
period.
never even.
Yeah.
It's another aspect of it. So tell me about the point in your life when you decided for hormone replacement therapy.
That was just recently, actually, in the last 6 months. I just started hormone replacement therapy, and the chief complaints that I had been having were more so around daytime fatigue. My sleep has always been good. I've never had sleep apnea before. I've taken many sleep studies over the years, just regulating, making sure things are good. I also continue to manage and maintain my airway, though, and so I can see, from CT scans and things like that, and also just managing data on. I don't track my sleep nightly, but maybe a few times a month I might, just to see what the numbers look like in general. But I can tell by the way I don't wake up during the middle of the night. I sleep throughout the night. When my head hits the pillow, I'm asleep within 2 or 3 minutes, but during the day, still feeling some fatigue despite just sleeping, well and breathing well. So that is one of the main things that actually drove me in to determine better and get extensive blood work done around what might be going on another level, and really go down that path to see. And I was not surprised to see that all of my levels were off, and I could really benefit from having hormone replacement therapy. So I was excited to get started.
Yeah. I found that anything you do as far as wellness and longevity, if your hormones are not optimized, you're wasting your time.
Yes.
You need the support of your endocrine system.
Yes.
You just do.
Yep.
And it's so important that everyone understands that. It's sleeping, breathing,
Breathing especially.
digestion. You talked about gut health
Yes.
too, as
Yeah.
far as breathing goes. Tell me about you. Just colitis.
Yes, all of that was, again, so disturbed for me because of, one, I ate a clean diet. I'm very, good about my diet and what I was taking in. But at the same time, because of how many times that I had been on antibiotics, and this was a long time ago because I haven't taken antibiotics in decades. I haven't needed to. I've been healthy. I've been breathing well. I've been sleeping well.
Yeah.
So that's been a wonderful thing. But before, that was once a month or every 6 months. I had different types of antibiotics going through my system, and so my gut was destroyed with all of that. So I had to slowly start to rebuild it. And again, the breath work helps to regulate that stuff as well too. But diet, exercise, all that, you know, the whole thing, you know, around everything that you're doing lifestyle wise to help stabilize it. But especially fiber intake. A lot of people don't realize the importance of fiber in your diet as well too. So that was a big benefit. But yeah, it's wonderful to have a healthy gut.
Yeah, and the mood, when your mood is stabilized too, from breathing well and sleeping well, because the gut-brain axis, I always joke, I always say the gut and the brain are best friends.
They are.
And they talk trash about all your other organs.
Yes.
They run the whole show.
They do.
So if you're not sleeping well, your mind's not working right, you're not getting oxygen to the brain, it's really going to affect not only your function in your life, but your gut.
Yes.
And that's something that a lot of people don't talk enough about, I think, is being regular in your gut, especially women as we get older.
Oh, yes.
Not supposed to talk about that stuff. No one ever wants to talk about pooping, but it's really, really important. And I'm so fascinating to me that the connection that you've made between proper breath work and this type of self-care for even gut health.
Yes.
It's amazing. It was just amazing. And I would like to talk about this. Okay.
My before and after
Explain
photos.
This is extraordinary.
And that was a long time ago. That was around 2010. So that was quite a while ago when I first started treatment. So that photo on the right, that before photo, that was me when I had a lot of pain. But you can see from just how the round shape of my face, the gummy smile that I had, my as far as what I was concerned about as well too. One was mainly the pain that was underlying. So that's what you couldn't see in a photo was the pain level and fatigue that I was having and the issues breathing. But the outside appearance there, from looking there, I just did not like, again, the asymmetry in my face, the gumminess of my smile. My teeth were shifting and moving. I had what was called a crossbite, or the jaw was underdeveloped on one side, so the teeth just didn't align well. That's part of what caused the jaw joint back here to wear down and be basically bone on bone by the time I was 30 years old. And so those were the things that were debilitating over time, because I was compensating for so long, my entire life, because my system was just not balanced well, especially in this head and neck area, to going and just unraveling all of that it's with something non-surgical, just, you know, using a mouthpiece at night while I was sleeping, and then just help to expand the jaw. So you can see in the after photo, which was taken basically about a year and a half, you know, after going through treatment. The jaw's expanded. I didn't have the gummy smile anymore. The face is more symmetrical. It's not as round. You can see the difference in the shape of the face.
Look at how much your jawline has completely changed.
It's changed, yes.
Your teeth have completely changed.
Yes. Yeah. It's transformative. It definitely
really
was.
is.
Yes.
I mean, and so what is the time frame we're talking about here when someone starts to wear it? And you wear it at night, and is this it here?
This is a different type of device than the one that I wore, but we do have different types of therapies. And so depending on how someone presents, then we just customize what they need. But yeah, that type of device that I used there was one that's called a DNA device, and it's worn early evening and while you sleep at night, and it helps to stimulate the jaw to grow and develop and move. So it's just a more natural process that's allowing things to change as an adult. And many people have thought that couldn't be done in adults, that we stop growing as adults, but there are ways to naturally signal your body to allow it to stimulate and grow. So that's been disproven with all the research that's been done. We actually help provide the clinical data, the research around getting that particular device FDA cleared to treat sleep apnea. It's been quite a while now, and over the last 5 years or so, I believe, when that got FDA clearance. So that's one of the only FDA cleared devices, medical types of devices that can address the root cause of sleep apnea that's available.
So I'm fascinated by this. You told me, you gave me this fantastic statistic about how often you have seen success in removing CPAP machines from people that have sleep apnea. So tell me about that, and tell me about the process in which one goes through as far as all the modalities that you have,
Yes.
non-surgical, non-painful, to relieve them of having to use a CPAP every night.
That's one of the most common types of scenarios that we see in our office, because there's so many people that have taken sleep studies, been given a CPAP to wear at night, and
Well, there's
can't
no other
tolerate
option.
it. And that's
That's
the
it.
first. That's been the first line of treatment
Right, and
for
then you're a
50
slave to
years.
it.
Yes, yes. So 50 years ago, CPAPs came out, and sleep started to be researched and discovered, and sleep breathing problems started to come to light around 50 years ago. So it really hasn't been that long in the scope of medicine that we've been focused on sleep, honestly, as important as it is. So, but within 10 years, so about 40 years ago, oral devices or mouthpieces, kind of similar to this type of style that we have here, came out as an alternative to a machine, a CPAP machine, because people were struggling with being able to wear a mask at night. So that is just basically a standard retainer that can be worn at night to help stabilize the jaw, or this lower part of the airway that I was talking about before. So behind the tongue and the jaw, that's what that helps to stabilize there. That's not the device that I use, because I used one that was changing and growing my jaw and restructuring everything. But for most people, they actually prefer, just if they can do something like a retainer like that, that's what they'll do. But historically, again, these types of devices have been around about 40 years, so there's a lot of data out there on them. And the research that's been done is basically shows that that type of mouthpiece that just brings your jaw forward at night and stabilizes your jaw is about 50% effective most of the time. So sometimes less, sometimes more, but average is 50%. This is also data that we've seen in our practice, because we measure everything very closely. So we do before and after sleep studies, we do before and after CT scans and airway images, so that we can see everything that's going on, and subjectively also manage how the patient's doing, making sure they're having their best results. So if the mouthpiece on average is 50% effective, only addressing the bottom third of the airway, that's when we think to ourselves, well, why wouldn't we want to address the middle part, and why wouldn't we want to address the upper part of the airway if there's a potential problem there? So that's where we became more comprehensive in our nature at Sleep Solution Centers, to be able to address those other things non-surgically. So one of the therapies that we do if the airway is restricted on our scans is a soft tissue laser therapy. So a CO2 fractional laser, just like you would use on the face. And I use this analogy all the time. So it's a fractional laser, just like we would use on our face, to help us look younger by tightening our tissue there. We just
And
use
it really works.
And it really works.
Yes.
It really does work. I've done that as well. We just use it in the throat to tighten the tissue there. And it works great because it helps you breathe and sleep at night. So it just goes and stimulates that collagen, those collagen fibers in that tissue, because that tissue, the soft palate tissue, is the tissue that starts to get weak and flabby and collapses in the airway when your estrogen levels drop, and when your progesterone and when those levels drop, that's when that tissue gets weak and flabby. That's when you start snoring and develop sleep apnea. And the thing is it's probably been going on for years as those levels slowly started to fluctuate, and then all of a sudden those symptoms came on, which seemed like it was overnight, out of the blue. So the laser therapy is wonderful, non-invasive, to help address that middle part of the airway. And on average, again, just from measuring our data, we can see, a good 30 or 40% increase just with laser therapy. Sometimes it depends on the scan and where the obstructions may be occurring, by looking at like the width of the airway and the shape of the airway and what might be going on in that area. So that's one of the most effective treatments that we have for the middle part of the airway. And then lastly, the upper part of the airway, that's the third part. We address the sinuses with non-invasive therapies there. So there's a balloon therapy that we do called nasal release therapy. It's an osteopathic type of treatment. It basically takes the tissues here, especially in the nose, but all without the head there, and kind of unjams them to allow things to release and start to flow. And that, again, helps balance the nervous system, breathe better, sleep better, reduce migraines, headaches, headaches, all that type of stuff. So basically, just kind of, we call it CPR for the breath, for the brain.
What is that process like? The actual
it's a non-invasive therapy. We do it for children and for adults. There's no anesthesia. There's no anesthesia with any therapy actually that we do in our practice.
Really?
That's how non-invasive our
Even the laser?
Laser does not need anesthesia either.
Come on.
Yeah, and we can use the laser even for tonsils for children, and not have tonsils taken out. We can just use the laser, and it just shrinks them right back down to normal. Then we get the child nasal breathing by helping them with a mouthpiece, and then.
I don't have to take my kids to the hospital, give them drugs, have their tonsils
We've
cut out.
seen so many parents come in that are looking for alternative treatments to removing tonsils and adenoids. Remember, I mean, I had mine out by the time I was 3 years
all my
old.
children
I know. And but we see tonsils removed so frequently, and then within a year, they're in our practice saying, why are these tonsils swollen again? I just had them taken out. Well, we didn't address the root cause. We're still mouth breathing.
What's the root cause? Mouth breathing?
Yeah, mouth breathing. So because the nose isn't working well. So again, we can do things like nasal release therapy, even for some of the children. We can do laser therapy on the children for tonsils, again, and just shrink them right down. And they're breathing better, sleep better. Within like a month or two, they're completely, back to normal, if not better than they were before.
And how impactful is that for a child? Concentration and mood,
Focus,
behavior?
ADD, ADHD,
Oh my
bedwetting, you name it. All the emotional issues that,
Sure.
yes, it's life-changing for the whole family.
Wow, that is an incredible aspect to it.
Yeah. So that's another thing is womb to tomb. We treat the whole scope. Yes, womb to tomb. Yes. So it is. Anyone can benefit from better breathing, and that's how non-invasive these types of therapies are. Is starting. As soon as you see the first sign or symptom, is get it evaluated and see what can be done to be conservative and prevent from things from combining and piling up on us, because oftentimes by the time we get to the solution, there's years worth of damage that have been going on, and you're having more to go through to repair and recover
Surgeries
from.
and prescriptions
Yeah.
and all those things. So my son is a patient of yours, and he was just blown away how extensive the care is, and you can do it all in the Sleep Solution Center.
We do everything there, from
the
sleep
homework,
studies. Sending you home with a sleep study.
Yes.
We don't do studies in our office. We actually send you home with a little ring you wear on your finger.
But you didn't have to go to some weird place and
sleep.
Yeah. So walk us through that process, because it was very impressive. The fact that you don't have to go to some weird place for a sleep study.
Yes.
The fact that you can do a CT scan in your office.
In the office,
everything.
we don't have
and
to
the fact
refer
that you're
out.
sharing those results with me, and I can see it, and you're explaining it to me, I can understand it and really kind of be a part of that whole process.
Yeah.
So when I walk in the door and I'm a mouth breather and I can't breathe, and I've been through surgeries and all those things, the modalities that you use are so effective. They're so easy, pain-free. My son was blown away by it. So
I'm
walk us
glad he
through
had
that.
a good experience.
He did. It was incredible.
That's exactly what we want patients to understand what's going on. And when you see these images of yourself and you see a functional breathing study to show you how poor your nose is working for you, that information, it tells you the truth of what's going on. And you don't have to know how to read an X-ray to see if there's something inflamed or restricted or crowded or crooked on there. So it makes sense to be able to see it that way. So yeah, from start to finish, we evaluate everything from when a patient comes in, from that examination process, and then going into, again, the different types of therapies that may be available to really address the root cause of the problem.
So they not only are you giving them the scans in the center, but you're sending them home. How do you record that data?
Yes.
And you have this technology at your fingertips to send them home with it?
It has been wonderful. The advancements in technologies around sleep studies has improved drastically over the last 17 or so years that I've been focused on airway and sleep for patients. That technology has come a long way. So now it's as simple as putting a ring on your finger. It's different from an Oura ring. It's a little, still just a ring that goes on though overnight, syncs to an app on your phone, and records data that is looking at how you're breathing, the stages of your sleep at night, as well as the function of how many times you stop breathing at night. So it's basically has an algorithm that's FDA cleared to diagnose sleep apnea, sleep breathing disorders in children and adults. So helping to be able to evaluate, and then from there, if you see anything that is more elevated or triggered, or if the health overall of the patient is more critical, then we can easily refer in lab for a sleep study, but it's not as often that that's really done anymore. The most common way to test for sleep breathing disorders today is with a home sleep study, but again, a ring is a very easy way to do that with extremely accurate data. I've used almost every type of home sleep testing system out there over the last, almost 2 decades, and this is by far the best technology that I've seen to gather that information, and easy for the patient as well too.
And that's the key too. It's easy. Yeah. The fact that that's what we do here. You can come in here. We do all of our, for example, we do all of our blood work in house because it's a one-stop shop. Come here. I can help you answer all your questions, and it's incredible. The technology is incredible because I can remember my husband going to sleep studies, and you had to go into this weird room like an asylum, and you just sit in there and have all these things attached
They're
to you.
30 leads, head to toe. 30
How
leads
are you supposed
that
to
are
fall asleep with
basic.
all these wires, and then someone's watching
And then somebody's
you.
watching you while you're sleeping.
How are you supposed
I
to
know.
fall asleep?
And it has started to change over the years, and insurance was one of the drivers behind that, because the insurance companies, once the technologies of home studies came out, then that was cheaper for the insurance companies to do that. So then they, of course, yeah. So, but the data is accurate enough now where you can really get a good picture around it. And again, if need be, you can always go into a lab, but there are pros and cons. Again, you're not in your own bed, in your own environment. You have leads hooked up. You're not sleeping in the same position you typically would.
Sure.
And so it's a case by case, but it's more so, again, a more critical patient that would be referred in there, so severe cardio problems and other systemic health issues where they do need to be in a lab. But it's few and far between these days with a lot of the people that we see, because we're trying to catch this before it becomes that debilitating. We want to screen you and evaluate you when things are still good, but the early first signs of any symptoms may start to appear, so that way we can prevent the issues later on from you having to be seeing a cardiologist and all these other specialists. Any type of specialist that you could name is going to root back to how you're breathing. It all ties in with how you're breathing.
It really does.
Every organ system is affected by your oxygen in your body, or lack thereof of oxygen. So it's a key driver to all health issues, honestly, is the root cause usually stems from some perspective along the lines of how well you're breathing and how well you're sleeping at night, because sleep is the only time your body can rest and recover and restore itself. Can't do that while you're awake. So it's those proper stages of sleep, getting deep, restorative sleep, getting proper REM sleep. You're downloading all that information you took in and ready to capture more the next day.
Sure.
Yeah, it's a process.
You may as well be drunk.
Yes.
That's how, I read a study on postpartum women breastfeeding or just up with the baby at night. They're
delirious.
May as well be drunk.
Yes.
And now you're having to care for an infant.
Yes.
Or drive a vehicle.
Oh,
or make some critical decisions in whatever your profession might be. Being sleep deprived. I think a lot of people go through life that way.
Yes.
And it's fantastic that you have discovered this and you're treating it in such a easy way.
Yes, it's honestly it's not hard to do, and part of our passion is actually being able to share this and spread it and be able to offer it in more places. And so as we continue to grow, that's definitely part of the plan, is have this more widespread in our community, medically being able to take it in. To start addressing things early on before, again, they become more problematic for us. And we can cut off a lot of health issues and help to reduce many other chronic problems. So
that's what I love about hormone replacement, is you're heading it off at the pass so that you're not chemically dependent. When you're older, you can, there's so many things, just like you're saying, the oxygenated blood and breathing is so important. And for us, your endocrine system being regulated by your hormones is crucial. And I really feel like things happen for a reason, and I met you for a reason.
Yes.
I'm I'm thrilled to learn this new aspect of wellness and longevity and the way that you're doing it.
Again, exactly what you're doing. So it is the perfect pair of how everything comes together, because we're addressing these structural issues, helping firm and tone and tighten the tissues and stabilize the tissues and reduce inflammation. But you're coming internally with the hormones to help balance everything out. And that's the perfect marriage. You need both to be able
You
to
do.
get the optimal results.
You do.
One or the other, yeah, you can see improvement. But when you add those two together, wow, now you've got Superwoman.
So true. It's so true. You don't know how bad you
Yes.
feel until you feel good.
Yes.
Yeah,
And Superman.
yeah, very true. I know.
We can't leave them out.
I know. I always do. I always do. I'm really trying to work on that. They needed to. They needed to. You've really rebuilt. You've broken down and rebuilt yourself twice now. I mean,
have.
you're really thriving.
It's wonderful. It feels great. But this is what keeps me going, because nothing is static and still. I mean, it's always this constant ebb and flow. You know, it's this natural rhythm that we're going throughout life. We go through cycles, just continuously going through cycles. Some cycles are going to be easier, some might be a little more challenging, but we have to stay on top of things, and we have to listen to our body, and we don't need to wait. Also, as women, we need to learn to say no more. I can tell you that. I see so many female patients, and we just tend to hold the weight of the world on our shoulders, and we just to stop and let some things go and breathe,
And breathe.
and take care of ourselves, you know, as we're taking care of everyone else all the time. So those are very important things to learn, and that's a big focus that I've taken, you know, for myself as well too. I moved down here less than 3 years ago to start up this new company. I sold my previous company and started Sleep Solution Centers here. So I never thought that at nearly 50 years old, I was going to be starting a new business and a new.
I say that all the time. I cannot believe every time I go to a new serotonin location, and I know that you have you're going to be expansive as well. I can't believe I'm here. I never thought in a million years.
I know, but I don't feel like I'm 50 years old. Everything from the body composition to the energy levels and all of this. I mean, I feel like I'm like 30, 35. So I'm good. I'm good to go.
Me too.
But that's what it takes to stay on top and stay ahead, is really focusing and paying attention to these things and not letting them continue to build, and listening to your body when it starts to scream at you. Don't let it scream when it starts, even if you hear the first whispers coming out and those subtle changes, like listen to your intuition and follow what your body's telling you, because when things start flaring up and acting out, there's a reason why that's happening. That's an early sign or symptom.
You need to listen when your body is telling you, whether it's emotional pain, whether it's physical pain, it's your body is indicating something's wrong here.
Yes, and oftentimes it's rest. It's resting. We tend to overdo it.
Crucial.
Especially
Resting
these
is
days.
crucial.
There's so much going on. So many people's nervous system is just sympathetic overdrive. Foot is on the gas all the time.
Especially these days. Yeah.
I know. So everything, especially screens and just life in general, is so much faster, it seems like, than it ever has been. So there's more need to stop and rest and recover and repair. And that's a big shift that I've taken in the last year in my life, is focused around all those things. Despite having, again, a startup business in the first couple of years here and all of that going full speed ahead, but it's when I'm not in the office, I'm very happy to be recovering and lounging and relaxing.
Just relaxing.
I do. I love it.
I saw my daughter. She was, listening to music. Young people, they don't even, or maybe most people, I don't know if it's just young people, she didn't even listen to the full song. She was playing music. She didn't even listen to the entirety of the song. It's like, what, 2.5, 3 minutes? Nope. Just click to the next song, click to the next song. They don't even finish a song anymore.
That's, again, what's happening to the brain these days.
Right?
It's very upregulated. So the therapies that we offer help to stabilize and downregulate the nervous system and calm the brain and the nervous system.
That's why there's so much anxiety.
Exactly. Yeah, and the poor breathing stems the anxiety. So that's... Yeah, it's amazing how things are changing for us. There's a lot of data around that as well too. What the screens and things like AI are doing, and so we have to be careful. So more time than ever, just rest, recover.
So true. Rest and recover it's so important. So tell us, how can we book a consultation with your practice?
Yeah. You can reach out to us, sleepsolutioncenters.com, and one of the girls in the office would be happy to send you a welcome video, share more about our practice and what we do and how we can help. And then we'll get you right in and be able to evaluate and go from there to make sure that you're breathing well, sleeping well, and just have that health span that people really need and deserve.
Yeah. It's incredible, the extensive care that you get on site. I mean, give them a call,
We
you'll
do as
love it.
much as we can in office, and very rarely, again, we refer amongst people like you, colleagues that can help in other avenues. So one of our phrases also is collaboration cures. So we do want to collaborate and need to collaborate, and often, collaborate with others. But at the same time, from our scope of what we're doing, yes, there's a lot that we can address and take care of there to get our goal is basically to help get our patients anywhere from 70, 80, or 100% improvement with whatever their chief complaint is, especially that they're coming in with. Oftentimes their chief complaint can, be things like snoring or poor sleep at night or difficulty falling asleep or staying asleep. Those are common things, especially with females that we may see. Clenching and grinding their teeth, headaches, migraines is a big one that a lot of people do not realize links to these types of things. Amazing recoveries with that. So that's our goal, is to help determine what might be the driving factors of this and how conservatively we can take a comprehensive approach to address it, and then keep it at bay. Not just treat and mask the symptoms that you're having, but actually address the root cause so it stays stable for you. So you're not having to come in. Our patients come in for their initial visit. Most of the care that we do maybe over a span of 2 to 3 months to really optimize where they need to be. And then we may see them, once a quarter for just a quick nasal release, or maybe once a year for a quick laser therapy touch-up. But we don't have to see our patients back on a regular basis most of the time. They're good. They're stable. They're thriving. So that's even better. It's not a place that you continuously have to visit every month in order to manage and maintain your health.
That's
So,
incredible. What
yeah.
you're doing it's revolutionary. So
thank you.
Thank you for that.
Thank you.
Everyone needs to go check out Dr. Tara's Sleep Solution Centers.
Thank you.
Well, thank you so much for being here today. I really
Yes.
appreciate you taking the time to share with us. I know how busy you are.
Thank you for having me.
Thank you.
Yeah, I appreciate it.
See you on the next episode of The Blue Room. Thank you so much for joining us today.